case 8350. This is a 76-year-old patient with left hip pain after slip and fall. This is a AP radiograph of the pelvis with additional frontal and frog leg lateral radiographs of the left hip. On the initial pelvic radiograph, we do not see a fracture of the left hip. We see severe osteoarthritis of the left hip joint, and we see post-surgical changes from a total right hip arthroplasty. On the dedicated images of the left hip, we do see some subtle lucency here, which may be a mock line as it seems to extend beyond the margin of the bone. On the frog leg lateral radiograph, we again see the subtle lucency that appears to extend up into the intertrochanteric region. So this was reported as suspicious for possible acute intertrochanteric and subtrochanteric hip fracture. This patient went on to get a CT, and we got coronal reformatted images. Even scrolling through these reformatted images on bone windows, it is hard to initially pick up this fracture, which goes from the intertrochanteric region into the subtrochanteric region. We can see the subtle fracture right here, and this was confirmed to be a fracture. We can also see that this is subtle on the axial images, which we can also review on bone windows and with bone algorithm. Again, we see the extensive osteoarthritis of the hip joint. We see the focal area of cortical disruption here as the fracture travels down into the subtrochanteric region, and the extent of the fracture is difficult to visualize in this plane.